Chow for the lecture. So now for the Q&A session, right? When you have a question, please raise out your hand and we will pass you a mic. And due to time constraint, we will restrict to 3 questions first. Yeah. So just on the break time, there was one lady who wanted to ask a question.
I did a scope and found I have ulcers. I was told I cannot take coffee and tea, but now in the market there's one kind of coffee with less acid. Is it okay?
Okay, if you have an ulcer, I presume that it's a duodenal ulcer as opposed to a gastric ulcer. Gastric ulcers, we are more concerned because gastric ulcer can mean a cancer. Duodenal ulcers are more rare to be cancer. Of course, if you have an ulcer, the treatment for ulcer is not just to avoid coffee. I hope the doctor has given you some medication to treat the ulcer. Right. If you have an ulcer and it's not treated, then of course any increase in acid will make the ulcer worse. You see? So taking coffee can increase the level of acid. But for most people without ulcer, in fact, just taking coffee itself will not give you ulcer. Coffee makes ulcer worse, it does not give ulcer. Coffee has an unnecessarily bad press because it tends to give rise to increased secretion of acid. But coffee, in a large study done in Singapore, has actually been shown to be good for the liver. So don't give up your coffee too readily. It's been shown that if you take more than 2 cups a day, up to 4 cups, it's actually good for you. If you take 4 cups and more, then it's actually bad for you. So moderate coffee drinking is actually not bad for you. If you have an ulcer in the duodenum or the stomach, you have to treat the ulcer. Of course, if you don't treat it, then drinking any coffee will make it worse. But the coffee itself does not cause the ulcer. Right? So if you have treated already, coffee is fine. Right?
Can a high B carrier be totally cured?
The totally cured is of course a concept. A hep B carrier today can have the disease totally controlled. But hepatitis B virus, what it does is that the hepatitis B virus, being what we call a DNA virus, while in the liver will actually insert some of its genome into the liver cells, you see, which is quite unlike hepatitis C. So scientifically, you will say that you always have some vestiges of the chronic hepatitis B in you. So in that sense, we can't say that it's cured. But with modern therapy, hepatitis B can actually be totally controlled. This is just as good as the cure. So getting treated for hepatitis B is actually very important.
2 more questions.
Yes, doctor. It's regarding CA19.9 marker. If it is diagnosed as higher than the normal range, around 40 plus, and it has been monitored over 2 to 3 years and still remain roughly around that level. After that, do you still need to continue monitoring the CA19.9?
Yeah, CA19.9 is a particularly challenging thing because it is a tumor marker that is neither specific or sensitive, in the sense that if you get a raised CA19, it doesn't mean that you've got cancer. On the other hand, you may have cancer and yet your CA19 is normal, you see. So it becomes a problem if it's raised. Of course, we'll do a scan to make sure you've got no cancer, but in a patient with continually raised CA19, usually at the cancer center, we'll give some treatment to reduce it. And if it's reduced, then we can all be very happy that it's unlikely to be due to cancer. If it is not reduced, then we would actually continue to monitor you. The worst thing is to say that, well, I have got CA19 and after 2 years, we don't see any cancer, I will never get pancreatic cancer. So if the 2 of them does not meet one another. The worst is that later on, if you do a test and it's high, you say, well, it was known to be high, I don't have cancer. Because the 2 are independent events. So we will continue to monitor these patients, but with the blood test, but not with the CT scan.
I was told in SGH there's no treatment for CA19.9 or in a way to bring down the CA19.9 to a normal level.
You can take anti-inflammatory drugs and can bring it down. Yeah, we can use anti-inflammatory drugs to bring it down, and it's usually brought down in most patients. Yeah, sure.
There's a high prevalence of stomach cancer amongst the Japanese, right?
Yes, that's right.
Is there any evidence to show that it has to do with the diet, being raw sushi, raw vegetables and stuff like that? Thank you.
No direct evidence. I think the greatest concern about sushi from Japan now is probably the radiation. It's been understood now that most of the cancer of the stomach is due to Helicobacter pylori, and the incidence of that bacteria is very high in Japan and other parts of Asia. The eating of raw fish and so on has not been shown to have a direct cause on why a patient gets a stomach cancer. So I think sushi is fine so far if it doesn't come from Japan today. But Helicobacter pylori is very, very common in our part of the world. Right? Yeah. Helicobacter pylori actually comes through the food, through contaminated food. But because the prevalence is so high, it actually runs in families. Yeah, right. So it's almost like hepatitis B in a sense.